Today here at the Richmond Veterinary Clinic, we're going to be showing you what a physical exam entails. Dr. DeMille will be examining our canine friend here, Marty.
Well, the physical exam actually starts out in the waiting room where I watch the patient as he interacts with his family and me, and then walks into the exam room. I want to make sure that he's behaving properly and well socialized. I start the actual physical exam at the head, so looking at the eyes and eyelids for any discoloration or lack of symmetry. Same thing with the nostrils and the general shape of the face and the muscles on the top of the head. I look in each ear for any discharge or lumps or bumps, and I also use my nose to see if there's any odors or abnormal odors. And then the otoscope to look down into the ear canals, again for discharge or any physical abnormalities. Then I look in the mouth, looking at the color of the gums and doing a test called the cap refill time, which is a test of circulation. I look at the teeth for their number and their positioning. And Marty's missing some teeth in the front. As well as looking again for symmetry and any lumps or bumps or masses. I look under the tongue, and then I do a little gag test to look down the throat and make sure that the nerves to his throat are functioning properly. I'm now checking the lymph nodes under the chin and palpating the throat for any abnormalities. Also seeing if he coughs while I examine that. Then out comes the stethoscope to listen to his heart and lungs. So while I'm doing this, I'm listening for any irregular signs or any irregularities in the heart rhythm itself. And then I listen on both sides and listen to the lung fields in different areas to make sure that everything sounds clear. Okay. Often while I'm listening to the chest, I'll be palpating the front legs, looking at the nails and the pads, again for any lumps, masses, or irregularities. Checking the skin as I work my way back towards Marty's tail. And I palpate his abdomen. And here I'm feeling for the kidneys, the liver, the intestines, the bladder, the bowel. And again, if I feel any lumps or masses, that would be abnormal. And feeling lymph nodes. Marty is an intact male, so I check out his testicles. And then the back feet. I'll often use a flea comb and check the skin for any abnormalities, as well as obviously checking for fleas and flea dirt. And then everybody's favorite part of the exam, the temperature. Okay, while I'm doing the actual hands-on physical exam, I'm also assessing the dog's body condition score, which is how much fat and muscle tissue they have. And then I'll be asking the owners questions about the dog's diet and behavior, water consumption, bowel movements, exercise, and addressing any concerns that the owners have in those areas.
And that is what our basic physical exam entails here at the Richmond Veterinary Clinic.